Greetings to you all. This is a detailed report on coronavirus disease 2019 or COVID-19. During this report, you will be hearing a brief background on coronaviruses, definition of COVID-19, etiology or cause, statistics and prognosis, symptoms and complications, diagnosis, treatment, and also prevention. Background. Coronaviruses comprise a vast family of viruses, 7 of which are known to cause disease in humans. Some coronaviruses that typically infect animals have also been known to evolve to infect humans. COVID-19 is one such virus, postulated to have been originated in a large animal and seafood market. Recent studies involve individuals who have no contact with animal markets, suggesting that the virus is now spreading from person to person. Severe acute respiratory syndrome, SARS, and the Middle East respiratory syndrome, MERS, are also caused by coronaviruses that jumped from animals to humans. More than 8,000 individuals developed SARS, nearly 800 of whom have died from the illness, giving it a mortality rate of approximately 10% before it was controlled in 2003. MERS continues to resurface in sporadic cases. A total of 2,465 laboratory-confirmed cases of MERS have been reported since 2012, resulting in 850 deaths, giving it a mortality rate of approximately 34.5%. Definition of coronavirus disease 2019 or COVID-19. COVID-19 is defined by the World Health Organization as an illness caused by a novel coronavirus, now called Severe Acute Respiratory Syndrome Coronavirus 2, SARS-CoV-2, which was first identified amid an outbreak of respiratory illness cases in Wuhan City, Hubei Province, China. It was initially reported to the WHO organization on December 31st, 2019. According to the Centers of Disease Control and Prevention, CDC, individuals at high risk of infection include persons in areas with ongoing local transmission, healthcare workers caring for patients with COVID-19, close contact of infected person, travelers returning from location where local spread has been reported. Etiology or cause. As we all know, COVID-19 or coronavirus disease is caused by a novel coronavirus 2019. How is it spread? The route of transmission is believed to occur via respiratory droplets from coughing and sneezing, as with other respiratory pathogens, including the influenza virus and the rhinovirus. Virus released in respiratory secretion can infect other individuals via direct contact with mucous membranes. Droplets usually cannot travel more than 6 feet. This virus can also persist on surfaces to varying duration and degrees of infectivity. Data has also suggested that asymptomatic patients are still being able to transmit infection. This raises concern for the effectiveness of isolation. Epidemiology, or some statistics on the corona outbreak and pandemic. As of April 7, 2020, COVID-19 has been confirmed in more than 1 million individuals worldwide and has resulted in more than 76,000 deaths. More than 180 countries have reported laboratory-confirmed cases of COVID-19 in all continents except Antarctica. In the United States, 369,069 cases of COVID-19 have been confirmed as of April 7, 2020, resulting in 11,018 deaths. As of March 26, 2020, the United States have more confirmed infection than any other country in the world, including China and Italy. Current clusters of increased local transmission can also be found throughout Western Europe, the United States, and Iran. The rate of newly infected persons in China, however, have dropped precipitously. Guyana, as of April 7, 2020 have reported 33 confirmed cases of COVID-19, giving also a death rate of 5. Now you may ask the prognosis of COVID-19. Early reports have described COVID-19 as clinically milder than MERS, or the Middle East Respiratory Syndrome, or SARS, Severe Acute Respiratory Syndrome, in terms of severity and case fatality rate. Thus far, the fatality rate for COVID-19 appears to be around 2%, according to the World Health Organization. In most cases, fatality occurs in patients who are older than 60 years and who have underlying health condition. Example, diabetes, cardiovascular disease, chronic pulmonary disease, cancer, and hypertension. Now, what are the signs and complications of COVID-19? Presentation of COVID-19 have ranged from asymptomatic or mild symptoms to severe symptoms and even death. Common symptoms have included fever, cough, sore throat, and shortness of breath. Other symptoms such as malaise and respiratory distress have also been described. These symptoms may develop 2 days to 2 weeks following exposure to the virus. The most common serious manifestation of COVID-19 appear to be pneumonia. Asymptomatic infection have been reported, but the incidence is unknown. Risk factors for severe COVID-19 include, but are not limited to the following: advanced age, immunocompromised state, diabetes, cardiovascular disease, hypertension, chronic pulmonary disease, chronic renal failure, liver disease, cancer, and severe obesity. Complication of COVID-19. Reported complications of COVID-19 have included pneumonia, acute respiratory distress syndrome, cardiac injuries, arrhythmias, septic shock, liver dysfunction, acute kidney injury, and multi-organ failure, amongst others, even death. Now, how is COVID-19 diagnosed? For any diagnosis, your physician or your medical doctor will have to ask you questions, listen to your question, examine you, and run some tests before coming up with a diagnosis. For COVID-19, COVID-19 should be considered a possibility in patients who are critically ill or who have unexplained viral pneumonia or respiratory failure. Also in individuals with fever or signs and symptoms of lower respiratory tract illness who have had close contact with an individual with laboratory confirmed COVID-19 within 14 days of the symptom onset. Also individuals with fever or signs and symptoms of lower respiratory tract illness who have traveled within 14 days of symptom onset to an area which sustained community transmission have been reported. Also persons with fever or signs and symptoms of lower respiratory tract illness who are immunosuppressed, who are older than 60 years, and who have underlying chronic health issues. Also in persons with fever or signs and symptoms of lower respiratory tract illness who have been critical for the pandemic response, including healthcare workers, public health officials, and other essential leaders. A chest X-ray or sometimes a CT scan can also be done for abnormalities. Definitively, the CDC have developed a diagnostic test for detection of the virus. This test is a real-time reverse transcription polymerase chain reaction, or PCR test, that can be used to diagnose the virus in respiratory and serum sample from clinical specimen. This is where your physician or your medical person will take a swab, sometimes a nasopharyngeal swab, and insert it into your nose to the back to receive sample, or a oropharyngeal swab, which will be inserted into your mouth to the back to receive sample. Currently, the diagnostic testing of COVID-19 can be conducted by the National Public Health Reference Laboratory, operated by the Ministry of Public Health in Guyana. Also, as of April 6, 2020, this institution is the only institution in Guyana that has been approved to conduct this test. Treatment for COVID-19. There are no specific antiviral treatment for COVID-19 as of this moment. Infected patients should receive supportive care to help alleviate symptoms. Vital organ function are also supported in severe cases. Also, there are no vaccine currently available for COVID-19. The CDC advised that non-pharmacological intervention, which is following the necessary precaution, washing your hands, wearing your face mask, staying at home, maintaining distance. These are the most important strategy in attempting to delay the spread and the reduction of the disease impact. Prevention. There are a lot of simple, easy steps that we can use to help prevent ourselves and loved ones from contracting COVID-19. First, hand washing. Viruses like COVID-19 spread when mucus or droplets containing the virus get into your body through your eyes, your nose, or your mouth. Most often this happens through your hands. Your hands are also one of the most common ways in which viruses spread from person to person. During this pandemic, one of the easiest, cheapest, and most important way that we can help to prevent the spread of this virus is through hand washing. Washing your hands with soap and water or sanitizer will help to eradicate this virus. A simple hand wash or a quick hand wash or hand scrub or hand sanitize wouldn't work. We have to know how to effectively wash our hands. To do so, step 1. Wet your hands with running water. Apply enough soap to cover your wet hands. Scrub all surfaces of your hands, including the back of your hands, between your fingers, under your nails, for at least 20 to 30 seconds. Step 4. Rinse thoroughly with running water. And finally, step 5. Dry your hands with a clean cloth or a single-use towel. How long should I wash my hands for? It is recommended that you wash your hands for at least 20 to 30 seconds. The same goes for hand sanitizer. When should I wash my hands, you may ask? In the context of COVID-19 prevention, you should make sure that your hands are washed at the following times: after blowing your nose, coughing or sneezing, after visiting public places, including public transportation, markets, or even places of worship, after touching surfaces outside of your home, including money, before, during, and after caring for the sick, before and after eating. In general, you should always wash your hands after the following: after using the toilet, before and after eating, after handling garbage, after touching animals and pets, after changing your baby's diaper and helping children use the toilet, when your hands are also visibly dirty. Always wash your hands. How can I help my child wash their hands? You can help your child wash their hands by assisting them, for instance, setting up a stool or something that they can climb on to reach running water and soap for themselves. Encourage them also to wash their hands for at least 20 to 30 seconds. Do I use warm water? Should I use cold water? Any temperature of water can effectively wash your hands, as long as you use soap. Do I need to dry my hands with a towel? Germs spread easier with wet skin more than dry skin. So it is advised that you dry your hands with a single-use towel or a tissue and dispose of that tissue in an enclosed bin. You might also ask, which is better, washing your hands or hand sanitizing? Both, when done properly and effectively, can help to eradicate COVID-19. Wearing a face mask. On the 3rd of April 2020, the Centers for Disease Control and Prevention, CDC, issued a recommendation to the general public. Even those without symptoms should be wearing face covering when in public settings where social distancing measures are difficult to maintain in order to abate the spread of COVID-19. When and how should I wear a face mask? Before putting on a face mask, clean your hands with an alcohol-based hand sanitizer or with soap and water. Cover your mouth and your nose with the mask and make sure that there are no gaps between the mask and your face. Avoid touching the mask while using it. If you do, clean your hands with an alcohol-based sanitizer or with soap and water. Replace the mask with a new one as soon as it's damp, and do not reuse a single-use face mask. To remove the mask, remove it from behind. Do not touch the front of the mask and discard of it immediately in a closed bin, and then clean your hands with soap and water or hand sanitizer. How else can I help prevent the spread of coronavirus? You can do this by using proper sneezing and coughing techniques. Cover your mouth and nose with a flexed elbow or a tissue when coughing or sneezing, and dispose of that tissue immediately in an enclosed bin, and wash or sanitize your hands. Also, avoid touching your face, your mouth, your nose, or your eyes. Practice social distancing. Avoid shaking hands, hugging or kissing people, sharing food, utensil, cups, or even towels. Avoid close contact with persons who have cold or flu-like symptoms. Clean surfaces that might have come in contact with the virus, and in general, clean all your surfaces frequently, especially in public spaces. And finally, if you or your child or any loved one have a fever, a cough, or difficulty breathing, or any other sign or symptom of COVID-19, please seek medical attention. Before you do that, please call ahead and let these officials know through the Ministry of Public Health hotline numbers that you are coming. Remember, stay safe, wash your hands, wear a face mask, stay home, stay home.